All right, welcome back. Here is part 2 of our BCBA task list 5th edition study guide. The first section, or part 1, I should say, covered foundations. Today, we're going to cover applications. We're going to save ethics for its own video, so be on the lookout for that. But today, we're going to cover everything else that we didn't cover in part 1. So be sure to check out part 1 for the foundations, and let's get into our applications. Let's get right into it. So we're going to start with F, okay? In F1, we're going to review records and available data, education, medical, historical at the outset of the case, okay? What this means is before you start your case, you want to get all the relevant background information, education, medical, and historical. Education is important because if they have an IEP, they have a 504, if they get speech or OT, they have a behavior plan in school, all of those things can help assist in your treatment plan because those are part of our team now, the educators. We are collaborative, right? So the educators are part of our team. So we should reach out to the parent or the school and try to collect any records we can. Medical is important because although we aren't prescribing medication, we're not doctors, it's going to tell us a little bit about their history, okay? Do they have other diagnoses? Do they have any allergies? Does their medication make them sleepy at certain times? Do they have strange reactions to medication? All of these things are going to be relevant as we consider time of day for sessions, okay, what we're doing at the beginning of session, middle of session, end of session. And remember, as behavior analysts, we always rule out medical problems first. So if something comes up through our treatment, can we point back to a medical cause or a possible medical cause? Rule it out before we start behavior analyst treatment, right? And then historical. So we want to know the history. Did they ever get prior ABA services, which might be the most important, okay? What were those services like? Did the family like it? Did the child enjoy it? What was the behavior plans like? What were the treatment plans like? We're never going to reuse these plans, okay? Everything we do should be of our own making. We're not going to plagiarize, but this can help us guide our services, what worked, what didn't work, what was reinforcing, what was punishing. Okay, the history of the client is extremely important. And part of that is understanding the records and available data at the outset of the case. Very straightforward, very common sense, but those are the 3 main categories they're going to wonder about on your exam. F2, now we're going to determine the need for behavior analytic services. Does this particular client or individual even need services? So before accepting the case, we need to determine several factors. We're not just going to accept everybody who comes to us. First and foremost, is there even a need for analytic services? Have you met the child? Have you met the parent? Is this child or client in actual need of services, or is it just available to them? Because now as doctors recommend ABA more and more, those client lists grow, some need it and some may not, okay? So we need to determine, is there actually a need? Now, looking from your perspective, do you have time? Okay. Do you have the competency? All of these are important. If you have a caseload of 15, which is large, are you going to have time to take on 16 clients? And if you specialize in autism and this individual has Down syndrome, are you competent enough to handle a child with Down syndrome? Both things you need to consider. That's similar to, does it fall within the scope of behavior analysts? So if we have a couple who comes to us and they tell us they need marriage counseling, can we provide marriage counseling in a behavior analytic frame without giving therapeutic advice? Because we still have to practice within inside our scope of behavior analysis, meaning environmental, operant behavior, and not mentalisms. So be sure that whoever comes to you is within your scope. And then finally, do you have the resources? If you're a small company and you might be the only BCBA, are you going to have the RBTs available, the materials available, and like we said, the time and the competency? And then when you're evaluating the needs, okay, and we're going to talk about socially valid behaviors, we want to know what our behaviors of interest are, right? How does it impact their day-to-day living? We can't target every behavior for change. And a lot of clients want us to do everything. Nobody's that good. Nobody has that much time. So we need to be very smart about what we're choosing when choosing behaviors of interest. And we start with their impact on day-to-day living. Okay, how does it impact their day-to-day? And then what about the impact around them? Do they have very disruptive behaviors in school? In restaurants, many families are unable to go out to eat or take vacations because of that behavior disrupting others around them. That could be a primary target of interest. So we're not just looking at the immediate impact on the client, but what about those around them? Is ABA the best option? We just talked about reviewing historical data and medicinal data, health data. Have all those options been exhausted? If we're having severe tantrum behavior, have we ruled out internal pain, internal needs? Okay, very important, right? I've had a client before and they've wet the bed. Okay, that's actually quite common. Can we rule out bedwetting as a medical need before we jump straight into behavior analyst work? And then, are the behaviors socially significant? Do they have an impact on the client's life? And not just because the client is quote unquote different or abnormal. We're not trying to make robots. We're not trying to make quote normal people. Okay, we're trying to target socially significant, impactful behaviors that's going to change the lives of that person and the people around them. Socially significant, one of the most important terms in our vocabulary. All right, F3, identify and prioritize socially significant behavior change goals. As you see, there's an entire section dedicated to socially significant goals in the task list. That's how important it is. Remember, applied in the 7 dimensions. This is what that dimension is talking about. Are these behaviors impactful? Do they have immediate or long-term benefits? Do they enable the client to contact the natural environment? Whenever we're programming, we need to program so when we're done teaching and services are done, is our client contacting reinforcement in the natural environment? Does this behavior matter in the natural environment? If the behavior only matters in a confined space, is it actually worth working on? And the behaviors need to be important to the client, the family, and society, which leaves a little wiggle room when you're doing your assessment and evaluating what's important to clients, because what's important to one client might not be important to other clients. But that's a line you have to walk. If we are handling behaviors that we deem socially significant, and there's a behavior the family deems important, maybe we work on it because it's important to them. All of these things we need to consider. Social significance should be your number one question when choosing behaviors of interest. And then identify goals. We identify goals through assessments, which we're about to talk about, through indirect interviews, direct observation, functional analysis, all these things through evaluation of the history, of the school history, of the medicinal history, right? All of these things build up to us identifying and writing goals. So you can see how the task list starts to build on each other, right? We have the onset of the case where we're reviewing all our previous records. We're now starting to choose socially significant behaviors, behaviors of interest. And now we're going to start doing what? We're going to start conducting assessments. So there are several assessments available to us. And the thing about being a behavior analyst is there's really no specific one that you must use. For example, insurances like TRICARE might require the PDDBI, but you may never use that if you don't work with kids with TRICARE insurance. The VB-MAP and the ABLES are two of the most popular assessments for young children with developing skills. Okay, but there's no specific criteria for what you should use. That's kind of up to you. So you need to identify, am I looking at social skills? Am I looking at beginning communication skills? Am I looking at motor skills? What am I trying to evaluate? And then go from there. Consider both strengths and weaknesses when designing treatment. Strength and deficits help guide your skill acquisition plans. So a pretty good rule of thumb, right, to ask yourself, whenever you identify a behavior from an assessment or a skill from an assessment, we want to know, is there a skill deficit or is it just a performance problem? Meaning, a skill deficit, the client is unable to do it under any circumstances. No matter what, you would not be able to do that skill. If you have no knowledge of how to play the guitar, or in this example, the piano, even if I gave you $1 million, at that moment, you couldn't play the Star Spangled Banner on the piano, no matter how hard you tried. That's a skill deficit. A performance problem, when we talk about things like masking, right? The skill is in the client's repertoire, but they cannot perform it when needed. Performance problems are very common with our kids because this is a what? Sometimes a generalization issue, right? When we're not generalizing this skill, so we teach them to play the piano at home, then when they get to a recital, they can't play it. That's a performance problem. We know they have the skill, but they can't perform it when necessary. This should guide some of your goals for skills and even behavior change. Can they not do it at all? Or is it an issue of stimulus control? Okay, ask yourselves your questions as you're going through your assessments of relevant skill strengths and deficits. Preference assessments. Now we have an idea of our client. We have their history, some of the skills we might want to work on, but how do we change behavior? Go back to your fundamentals. Well, with reinforcement, with punishment, and with extinction. How do we identify reinforcers? We conduct preference assessments. Okay, so a lot of these application task list items, you should remember from your RBT days. A lot of this stuff isn't any different than what we did as RBTs. It's just a little more in depth on the BCBA exam because now you're the one who's going to be determining what assessment am I using. And that's going to be the biggest difference between you and an RBT. You're now in control of what assessments you're using, what you're targeting, how you're running it. That's what's so different about being the analyst. So now we need to determine what preference assessment will we use to figure out what the client likes. Very important. Preference assessments are not reinforcer assessments. Even BCBAs make this mistake. What's the difference? A preference assessment simply identifies potential reinforcers. A reinforcer assessment actually evaluates, does a stimuli change a behavior? Reinforcer assessments and preference assessments are not the same thing. Just because something is preferred does not make it a reinforcer. So how can we conduct preference assessments? Well, the most basic indirect is through an interview. We can ask the client or the stakeholders what the child or client likes. Very basic, very straightforward, very indirect. I would not recommend basing your entire preference assessment on interviews, just like we don't base our entire skill plans and behavior plans on indirect observations. I always try to get one type of direct preference assessment under your belt. So that being said, we can do a free-operant, which is naturalistic, right? Where we are observing the client and timing how long they engage with an item or an items. Let's say our client's very young or they don't really show interest in anything. Maybe you just allow the client to roam around their environment and you simply are a fly on the wall recording what they engage in. Free operant, very naturalistic, uncontrived. Single stimulus. With a single stimulus, you're going to present one item at a time and see what they like. So first, you might present the black square. Do they like this? Yes or no? Then you present the green square. How do they react? Do they take it? Do they look at it? Do they like it? Yes or no? One at a time, right? And then maybe the yellow square. So each individual stimuli or stimulus is being presented one at a time, and you record the response. Remember, the key here is one stimulus at a time. On the exam, when you get to preference assessment questions, ask yourself, are we looking at one stimulus? Are we looking at two stimulus? Or are we looking at three or more? If we're looking at two stimulus, we're most likely looking at forced choice. So if we take our same example, instead of one at a time, your first one might look like the black square and the green square together. And what do they prefer? Then your second trial, we would take the green square and the yellow square together. And then finally, your third trial, we would take the black square and the yellow square. And what benefit does that give us? That starts to create this hierarchy where we can say, okay, they like the green square, they like the yellow square, and then they like the black square. So we are forcing them to choose between two stimuli. We're using all the pairs, and then we're creating this little hierarchy where we now say, okay, they like the green square best, yellow square, and then black square. Forced choice is probably the most common. It's the one that's typically ran mid-session very quickly. What do we want to work for? That kind of thing. And then finally, multiple stimulus. Remember, we're looking at 3 or more items at a time. Multiple stimulus with replacement and without, we would have in both instances, okay, this would be our first trial, right? We would have multiple stimuli on the table all at once, and we would ask them to choose. The biggest difference here is if we are doing multiple stimulus without replacement, okay, and our client chooses the black square. This is what our second trial would look like with multiple stimulus without. We would take out the black square, and we would just have this left. Okay, this is multiple stimulus without replacement. What about multiple stimulus with replacement? We're going to do the opposite, okay? They choose the black square, right? We are going to leave the black square in, and we're going to replace the other 2 squares with brand new items. Very straightforward. You learn this stuff on your RBT exam. Maybe you just need a refresher, okay? Now, with preference assessments, what you might be asked on the BCBA exam is some sort of limited hold preference assessment where you're giving them a certain amount of time to react to the item. When they start combining concepts on the exam, the concepts don't change. Always remember that. So if they're going to say the limited hold forced choice where they only have 5 seconds to respond to the 2 items, nothing changes, right? Still a limited hold combined with the preference assessment. They like to do that a lot. They combine a bunch of different terms together to try to confuse you. If you get confused, just break down each term you know. You know what a limited hold is, you know what a preference assessment is, and then put them back together. Preference assessments, not difficult. Okay, biggest thing, remember, preference assessments are not reinforcer assessments. All right, F6, describe the common functions of problem behavior. Hopefully you know these by now as aspiring BCBAs and BCABAs. If you don't, you got some studying to do. Okay, we all know what the functions are, right? Escape, avoidance, attention, access, automatic sensory. All right, we're not going to go too deep into these. You should understand how to hypothesize a function. So if they're going to ask you, what do you think the function might be on the exam, you should know how to do that. They might ask you about functional analyses and to hypothesize the function of the outcome. You should know how to do that, right? Negative reinforcement, escape avoidance is a type of negative reinforcement. Automatic sensory, okay, is not socially mediated. So remember, these 3, okay, are socially mediated, meaning there's another party involved. Automatic sensory, it's only the individual. That's kind of the long and short of functions. Okay, hopefully you know functions as an aspiring BCBA. F7, conduct a descriptive assessment of a problem behavior. A descriptive assessment is essentially just a direct observation of the problem behavior in the natural environment. Okay, so if you are at an assessment and you're conducting an interview, you might ask an RBT to conduct a descriptive assessment. Okay, this is typically going to be some sort of ABC data, some sort of event recording. You're really just watching the behavior as it occurs in a naturally occurring setting. This is typically going to happen prior to the start of intervention, or maybe during intervention if you were told new behaviors are occurring and you just want to watch the client in their natural environment without any contrived scenarios. That's what we're doing here, okay? It's just a direct observation in the natural environment. We have ABC data we can use. We have event recording, narrative ABC data. Very straightforward. Just remember, direct observation, natural environment. The best way to remember F is it's all building up towards a treatment plan, right? We're evaluating history. We're performing preference assessments. We're starting to observe them in their natural habitats. Okay, now we have all this data, all this observation data. What are we going to do now? Well, we know what the functions are. Let's start to identify the functions of our client's behavior. What's the best way to do that? A functional assessment, the highest level of identifying the function of a behavior. Indirect FBAs or interviews and surveys, the checklist. Okay, that's the worst way to identify the function. Direct is a little better. Functional analysis is always the best. Okay, what do we do here? We are systematically manipulating antecedents and consequences in order to determine the function of a target behavior. We're actually changing the environment. We're setting up the environment in an experimental setting, making changes, adding things, removing things to figure out, okay, what is our function. I think the biggest takeaway for functional analysis questions, you need to know the conditions. So we have an alone condition, an attention condition, an escape condition, and a play control condition. And then you need to determine what condition is being used, why is it used, and how to read a functional analysis chart. And the functional analysis chart is very easy. It's just a line graph that's going to show what conditions the behavior occur under the most. If the behavior occurs in all situations, typically that's going to be an automatic function. What are our conditions? Alone condition, used to assess automatic reinforcement. The participant is left alone. If behavior continues at high rates, the function is likely automatic sensory. So think playing by one's self plus stimming. Okay, I'm sure you've all seen that with your clients when they're off by themselves with their preferred item, no task demands, no nothing, and they're stimming. That's what we would call what? Automatic reinforcement. That's the alone condition. The participant is left alone with everything available to them. If behavior continues, function is likely automatic sensory. Attention. When the behavior occurs, attention is given to the behavior. If the behavior continues to occur or increase, attention is likely function. So in this scenario, client screams, give attention, client continues, we can hypothesize attention is maintaining this behavior. So as you see in a functional analysis, you're essentially reinforcing the problem behavior, which is why there's some ethical questions around functional analysis, right? You need to be sure it's the right decision whenever you're making the call. If we're getting some sort of high self-injury, dangerous behavior, maybe it's not the best idea, because you can see we're actually delivering reinforcement to these behaviors, right? To figure out, is that actually the function? So hopefully you can start to figure it out. What do you think we'll do during escape? Well, if we give task demand leads to BX, remove task. Okay. If the behavior continues, what do we say? Function is most likely escape avoidance. So you get the idea. Functional analysis aren't that complicated, right? They're just the most complex way of identifying a function. One thing to note is a brief F, or we should call it brief FA, okay? 10 minutes, real quick. Functional analysis are long processes, but a brief FA during session, maybe a 10-minute session where you're ethically and smartly reinforcing a problem behavior is okay. Okay, we can also conduct brief FAs because functional analysis can last, an hour or more, right? We're setting up experimental conditions. It's a very controlled thing. But brief FAs, we do a 10-minute, real quick hypothesis, can be done as well. And then finally, play control. This is our control setting. Participant has free access to reinforcement. Low rates of the target behavior are expected in this condition. Now, think about it. If the behavior continues to occur during play control, what might you start thinking? I would immediately start thinking maybe automatic reinforcement, right? So that is our FAs, the best way to figure out the functions. Spend a little bit of time looking at some FA graphs, right? But those are very simple to read, and you'll see what I mean. I mean, it's literally a graph okay? And each function has its own color, and it's going to look like this, right? We got a line, we got a line, we got a line, and then let's say, red is attention. If red is way up here, all right, what do you hypothesize the function is? Attention. Very straightforward. F9, interpret functional assessment data. All right, another change as the analyst is what? Well, now you are the one who's going to be interpreting the data. So we've done our FBA, we've done our functional assessments. We need to start identifying. And what are our different types of functional assessments? Well, we just covered our functional analysis, right? So we should know what that is by now. And we covered a little bit how to interpret that data. You're going to graph them. You're going to graph all 4 conditions on a chart and then identify when does the behavior occur, when does it not. Indirect observation, what are we looking at? Interviews, checklists, surveys, a lot of spoken, subjective, anecdotal observation. Not good enough on its own to make a treatment plan, but helpful. However, always want to have a direct observation in addition to really get the best data. Okay, you can't just have an interview with a parent for 30 minutes and write a treatment plan. Okay, not how it should be done. We need some sort of direct observation. This is when we're using our ABC data, event recording, narrative recording, observing this client in the natural environment. Maybe we're probing stuff, right? We're probing, okay? We're just looking at what they can and can't do. It's a standard form of FBA. You've probably done it a million times, right? It can help hypothesize a function. Once we do that, then if we have time and the resources, we can do a full FA. Most people will just do brief FAs and get to a function. So how does that look, right? Indirects, are 1, 2, 3. That's really how you wanted to look at it. However, indirect should never be alone. We always want to do a direct observation as well. Again, you learn this stuff as RBTs, okay? Your direct observation data might be frequency data, right? How are you going to record? How are you going to interpret that? Maybe you convert it to rate. So if we have, the behavior happened 5 times during our 1-hour session, right? What do you might say? Okay, that behavior happens 5 times an hour, and using that, you might say, yes, it happens often enough to target it, or not often enough. Maybe we shouldn't worry about it. Okay. All right, moving on to G, using positive and negative reinforcement procedures to strengthen behavior. Again, super easy stuff you should definitely know. What does reinforcement do? Reinforcement increases or maintains future behavior. How do we determine if something is reinforcing or punishing? We look at the future behavior. Consequences affect future behavior. I'm going to write that one more time. Consequences affect, okay, future BX, right? So how does it work? We have our SD, we have our response, and our consequence. That consequence comes after the present behavior. The consequence affects the future behavior. That's how you know is something reinforcing, is something punishing, or something nothing. What is positive reinforcement? We are adding stimuli to increase BX. Okay. Praise, tokens, food. Negative, removing stimuli to decrease BX. This is escape, so break, reducing the demand, removing the demand. Positive, negative reinforcement, very straightforward, right? Using interventions based on motivating operations and discriminative stimuli. Motivating operations. So they want you to know a few different things, and I'm going to chart it out, right? So what do we have? We have our MOs, okay? MOs can lead to what? They can lead to, let's do it, abolishing operations, okay? And / evoke, okay? Or they can lead to, establishing operations / evoke, or they can lead to abolishing operations / abate behavior, okay? So If we have a motivating operation, it establishes a reinforcer, all right? That's going to evoke the behavior typically. If we have a motivating operation that abolishes a reinforcer, that's going to typically abate a behavior. And that's very important to know on the exam, right? We have the value altering effects of that reinforcer, which is the MO, alters value of consequence, right? Typically a reinforcer that either establishes that reinforcer or abolishes that reinforcer. When it establishes that reinforcer, typically behavior is going to be evoked, right? Because the value, the temporary value of that consequence is typically more desirable, right? So if we're talking about reinforcers, when that reinforcer becomes more desirable, we might see more behavior evoked, okay? MO is very, very straightforward, right? How does it go? We have our MOs come before our SDs. This is our 4-term contingency, response, consequence, okay? MOs alter the value effectiveness of the stimulus object, and they can evoke or abate behavior, meaning we can see more behavior because of the MO, or we might see less of the behavior because of the MO, okay? Of course, our antecedents, right, happen before the behavior. They're manipulated before the behavior occurs, right? So antecedent interventions are proactive. We're trying to prevent something from happening, right? We're trying to evoke something before it happens. And then our discriminative stimuli is a cue or stimulus that is present when a BX is reinforced. What is the difference between an MO and an SD? An MO, okay, typically you will want something or not, right? The MO is either going to make you want or not want something, right? The motivation to obtain the consequence is there, or the motivation to not obtain that consequence is there. The SD, what does the SD do? The SD says that consequence is available, okay? Very simply, MO makes you want or not want something. That SD says that thing is or isn't available. And if it is an SD, then it's going to be available. For example, all right, if I'm starving, okay, the MO is being hungry. I really want chicken tacos. The MO is there. I'm hungry. I haven't eaten in 9 hours. Not until I see chicken tacos available is there an SD. That's the main difference. I know I've spent a lot of time on MOs and SDs, and if you're bored by this section, good, because you would be surprised how hard MOs can be for some people, right? If you're one of the lucky ones who have it down, that's great. If not, work on it, work on it, work on it, okay? You will get it. Okay, G3, establish and use conditioned reinforcer. What is another term for conditioned reinforcers? Secondary reinforcers, okay? Remember, primary reinforcers are what? Unconditioned. So how do we condition reinforcers, right? We pair them with other reinforcers to gain reinforcing properties. Tokens, praise, money, okay, don't inherently have reinforcing properties typically, all right? So let's just assume tokens and praise and money don't have value, right? Until what? Well, until we pair them. Until you take that money, okay, and you buy, I don't know, a car, right? You long before that we paired, but you get the idea. Until that money and that car repaired and you learn, okay, this money has value because I can exchange this money for a car, that money means nothing, right? I've had clients before who are given $100 because, you know, they're 10 years old, they get $100. It means nothing to them. They haven't learned the value of that money. That money hasn't been paired with anything. It has no reinforcing properties. Again, how do we do it? Simple pairing, right? You deliver praise at the same time as a reinforcer. You pair tokens and money with backup reinforcers. Okay, those backup reinforcers are essential, especially in token economies. Okay, so Example, I know my client likes Cheetos, but I want them to not eat so many, right? So the client loves chocolate, loves Cheetos, but unhealthy snack. The parent doesn't want you to use these edibles as much. What are you going to do? You're going to pair those Cheetos with praise or tokens, and we establish a generalized condition reinforcer, a GCR, reinforcers that can be used in a variety of situations and a variety of behaviors. Tokens are the most common GCR probably because you can use them anywhere. Praise is a fantastic generalized condition reinforcer. If you can make yourself a generalized condition reinforcer, you've hit the jackpot because the kid's just willing to work for you, right? But you can only do that by pairing yourself with other things that are already reinforcing. Pairing is essential to establishing these condition reinforcers. What are our primary reinforcers before we move on? Just quick refresher. Primary reinforcers or unconditioned. That's like food, water, sex, warmth, things we were born needing, no pairing necessary. G4, use stimulus and response prompts in fading. Errorless, most to least to most. Major difference, because most of this was on your RBT exam, and as RBTs, if you are an RBT, you might already know this. Major difference is you do need to know the difference between a stimulus prompt and a response prompt. What is the difference? Stimulus prompts act on the stimulus being used. Okay, so if I am teaching triangle, okay, if I'm going to do a stimulus prompt and the triangle looks like this, what might I do? I might increase the size of that triangle. I'm not prompting on that desired response, I'm changing the stimulus. That's a stimulus prompt. The response prompt, you're actually evoking the prompt you want to see. You can verbally evoke it. Go to the trash can. You can model it by, for example, dancing. Model a dance move. You can gesture or you can physically prompt. Biggest difference is you need to know that. You need to know the difference between what's a stimulus prompt and what are some response prompts you can use. Physical and partial physical are probably the most common response prompts. Those act directly on that desired response, but modeling, gestures, and verbal also evoke the response you want to see. Anytime you're altering the stimulus or the stimuli in the environment, you're using some sort of stimulus prompt. What do we have? We have errorless prompts. So when we're errorlessly teaching, we're trying to block and redirect any incorrect response before it happens. Point to blue, block and redirect, and any attempts at pointing to red, and redirect right to blue. This would be an example of a response prompt. We're blocking and physically prompting the right answer. Stimuli is not changing, it's still red and blue. We're just making sure, no matter what, we are pointing to blue and being told point to blue. Now, what is most to least? Well, and least to most. Remember, we have our prompt hierarchy, right? So if we have our hierarchy like this, okay, what's it at the top? What's the most? Well, physical, partial physical, modeling. And then depending on who you ask, right, we have gestural, verbal. Okay, just depending on who you ask, those can change, but you get the idea, right? We have our most intrusive, okay, physicals, partial physicals, all the way to the least intrusive down here at the bottom. So when we talk about most to least, you're going to start with one of these most intrusive prompts, slowly fade it to least intrusive. Least to most is the opposite. You're going to start with the least, slowly increase it as needed up to the top, okay? What about graduated guidance? Graduated guidance is a type of physical prompting. You're going to add as much physical prompting as needed, and then as soon as they don't need it anymore, you fade it immediately. So for example, you hand over hand, they don't need a hand in hand, fade it, okay? Maybe go, if they need it again, you just touch the elbows, fade it, right? So a very quick, rapid fading of physical prompting. Prompt delay, you're increasing the time between the SD and the prompt. If you're trying to fade a prompt or reduce prompt dependence, you might first deliver prompt, okay, 2 seconds after. Now you're going to prompt delay. You're going to give the SD, wait 10 seconds before you prompt, and then prompt. So give them a chance to answer without the prompt. And then prompt fading, extremely important. Why? Avoid prompt dependency. Okay, so removing the prompt systematically to control to the real SD. When we talk about stimulus transfer control, that's essentially prompt fading. When we have our prompts, how does that look? That contingency or that sequence looks like SD prompt behavior, right? So that prompt is evoking the behavior. When we fade or transfer control, we want the SD to control the behavior. We want it to look like SD behavior. Okay, so that's what we mean when we say transfer control or fade the prompt. G5, use modeling and imitation training. Imitation, very misunderstood. How do we typically run it? How do you see it typically ran? Well, you say copy me. Well, saying copy me and the person copying is not imitation. Why is that? Because imitation is evoked by a nonverbal SD. True imitation is not evoked by copy me. True imitation is evoked simply by seeing something happen and copying it yourself. That is true imitation. Okay. They are going to want to know that you know that on the exam. So modeling is demonstrating a skill or ability for a learner, right? You can plan a model, right? So you can set up imitation. You can have an unplanned model where you're at let's say a hockey game and everybody stands up and you stand up. Those are unplanned models. Nobody contrived those models for you. That's just what happened in the natural environment and you imitate. Really, our goal is to get our clients to start imitating unplanned models. We teach using planned models, but eventually these unplanned models is what we want them to imitate. Imitating is the learner copying a skill or ability. Shaping is an important part of modeling imitation. What is shaping? Successive approximations. So if we want them to raise their hand, just for example, and they raise their hand, halfway off the desk. If we're going to shape, we're going to reinforce that approximation, right? And then they raise their hand 3/4 off the desk. Shape it until we finally get that full imitation raising the hand. Okay. Imitation, very straightforward. Remember planned model, remember unplanned model. Remember, imitation is evoked by a nonverbal SD. Imitation is not evoked by copy me. It is not evoked by a verbal discriminative stimuli. G6, instructions and rules. Primary difference between instructions and rules is what? Well, instruction, okay. Instructions are a response prompt that tells you what to do, right? So, you're reading prompts, you're reading instructions in the back of a brownie box, instructions on a worksheet. Rules are a verbal statement of a contingency, okay? So you're understanding through a sign or somebody tells you a rule that you can or can't do something, okay? Behavior is not maintained, right, by the actual consequence with rules, okay? Instructions and rules both inform a learner of what they should or shouldn't be doing. The main thing here is, right, behavior not maintained by actual consequence. When you read a sign that says no loitering, if you've never loitered in your life, did you ever contact a contingency for loitering? No. That rule is dictating your behavior without a contingency in play. That's the main difference between rule-governed behavior and contingency-governed behavior. With contingency-governed behavior, what happens? We actually contact reinforcement and punishment, and that affects our future behavior. Okay, another rule, wait 30 minutes before going into the pool after you eat. Most people might say, well, I don't understand that rule. I've never had issues. I've never had any contingencies of that. But still, a lot of people follow that rule, right? Instructions, again, a response prompt that tells you what to do. So you're reading the back of a brownie box, right? You're reading a worksheet. Okay, someone's telling you instructions. Same vein, most importantly, behavior is not maintained by the actual consequence. For rules, you have rule-governed behavior and then contingency-governed behavior. G7, use shaping, using differential reinforcement on successive approximations of behavior. Hopefully by now you've shaped millions of times in your life. Okay, We use shaping all the time for functional communication training. How do we do that? Well, we take steps for smaller responses. Okay. Oops. Steps, sorry about that. Steps or smaller responses that lead to what? A final or terminal response. If we want to teach the word bubble, very common. This is our final response. What are we going to do? We're going to teach bu. Then we're going to teach bub. Then we're going to teach bubble, right? And then bubble. You're reinforcing along the way, gradually making that requirement harder and harder until we get to our terminal behavior. Functional communication is the most obvious one of these, but also, like we just talked about, imitation and modeling, shaping, very important as well. If you want someone to raise both hands in the air, you might have to shape that from smaller and bigger amounts of raising their arms in the air. Okay. Shaping is really hinging on successive approximations. Chaining. With chaining, you are now the behavior analyst. What do you need to do? Well, you need to conduct a task analysis. You need to pinpoint the steps of a behavior, of a complex behavior, and create and use those steps to teach that behavior to another person. Who can we look at, right? We can look at ourselves, okay, for that task analysis. We can look at experts of that, or we can look at other people proficient in the skill. So we can use ourselves as task analysis models, right? We can perform the behavior and mark our steps down. We can look at an expert performing that behavior. If we're teaching someone to ride a bike, maybe we look at an expert bike rider, right? Someone who knows how to do it. We can look at their steps, make those steps, and make a task chain out of those steps. Or we can simply look at somebody proficient in the skill who's able to do that skill, and we record those steps as we go. We don't want to look at someone who isn't proficient, all right? For example, if we have a 5-year-old and we're trying to teach them a skill, don't just look at another 5-year-old do the skill because they're also 5. Look at someone who actually is proficient in that skill. That's going to give you the most accurate task chain. And then you can adjust the task chain as needed. Okay, a task analysis breaks down a complex behavior into steps, which create a behavior chain. All right, so what do we have? We have forward chaining, we have backwards chaining, we have total task chaining, and behavior chain interruption strategy. What is forward chaining? Forward chaining is teaching that first step first. So if we have a chain of 5 steps, what are we going to do? We're going to take step 1, okay, reinforce, and then what? Prompt 2, prompt 3, prompt 4, prompt 5. We're teaching this first step first, prompting through the rest. Then we're going to teach steps 1 and 2. So 1 and 2, reinforce, prompt 3, 4, 5. You get the idea. We're going front to back. Backwards chaining, opposite, 5 steps. Okay, let's do a different color. 5 steps. What are we going to do? Prompt 1, 2, 3, 4. We need step 5 to happen. All right. So prompt, prompt, prompt. They actually have to perform 5 and then reinforce. Make sure you understand that, right? So we're in forward chaining. First step needs to be done for reinforcement, and we prompt through the rest. Backwards chaining, we prompt through the whole chain. Last step needs to be done for reinforcement. Okay. Total task chaining. Okay. Again, 5 steps. 5 steps. We might have them do 1, 2, 3. Okay, reinforce. 4, 5. We're teaching that whole chain. Okay, and only teaching specific steps like the 3. Okay, this is when the client already has most of the steps in their repertoire. They know how to do the skill. They just need to strengthen the behavior. Most of the chain is known, ability level is high. You can quickly teach them that whole chain. You don't have to go through that whole process of forward and backwards chaining. And then behavior chain interruption strategy. If we had 5 steps, okay, you would have, them do 1, 2, interrupt here, right? Interrupt. So you would change something in the environment, and you would have them evoke a new or novel response. So instead of this 3, okay, we have a different 3, right? Behavior chain interruption strategy, trying to teach new behaviors, evoke new behaviors, generalization strategies, that sort of thing. Chaining, pretty easy, pretty straightforward, no big deal. G9, use discrete trial, free-operant, and naturalistic teaching arrangements. So in ABA, we have many different types of teaching. Commonly, right, we have DTT. We have naturalistic, also known as incidental. DTT are standard order, SD, prompt, response, consequence, post-trial pause, reintroduce SD. Very important that prompt comes before what? Before the response. The prompt is an antecedent. Do not prompt after the response. Do not train prompts after the response. Super, super important. What is DTT good for? Great for teaching and strengthening. It's very rapid. Many targets ran very quickly. Not so great for generalizing skills. Typically, it's a very controlled, contrived environment. Different ways to implement targets in DTT. We can do a distractor trial. We have one of our target with 2 unknown choices. So if we're trying to identify tiger, we can mix in a car and a boat, 2 unknown choices, 1 target. Random rotation, we take 1 master target and 1 unmastered target and rotate through. All right, so that might be yellow, purple, yellow, purple. Maintenance, we just run master targets. So we only run known, too big, known targets. Okay. And then also we have mass trial, where we run the same target over and over again. For example, purple, 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 purple. Okay. And the naturalistic teaching, we're taking advantage of naturally occurring teaching opportunities, also known as incidental teaching, great for generalizing, great for functional communication. Use the environment to your advantage. If you know your client likes to eat soup, but they need a can opener, whenever they go grab a can of soup, withhold the can opener until they appropriately ask, provide the can opener. We're using naturally occurring scenarios like them getting hungry and wanting soup to work on their functional communication. And then free operant, no SD is necessary for response to occur. Response can happen multiple times. We were just in the environment with them, watching, observing. Response can happen over and over again without an SD needed. G10, teach simple and conditioned discriminations. What is discrimination? Simply the ability to identify a stimulus amongst other stimuli. It is very simple. Can you tell the difference between orange, green, blue? Yes, then you can do what? You can discriminate. Very straightforward, right? Very easy skill for us right now, but we have to work on this with many of our clients. We teach it through differential reinforcement. How do we do that? Well, we say point to orange. If they point to orange, reinforcement. If they point to green or blue, extinction. Differential reinforcement leads to discrimination and differentiation. Simple discrimination. A single stimulus has control over a response. You grab a Sprite instead of a Coke. You buy the red shirt and not the green shirt. Basic discriminations we make all day, every day. You identify blue over red. Conditional. An additional stimulus is present when a response comes under the control of an SD. For example, you grab a Sprite only after your friend says, "Can you grab me a Sprite?" The only reason you're discriminating is on the condition of grabbing your friend a Sprite over a Coke. You buy the red shirt because your date said her favorite color is red. Normally, you might not discriminate. Okay, you might just pick any shirt, but your date said, I love the color red. So when you go to the store, you're now discriminating. That discrimination was conditional on the fact that your date said her favorite color is red. G11, use Skinner's analysis to teach verbal behavior. I find it interesting that the 5th edition devotes so little time to verbal behavior. They kind of lump it all in one. Doesn't mean it's not important, right? Does not mean we don't need to know our verbal behaviors. So verbal behavior is what? It's reinforced by another person's behavior. Verbal behavior is socially mediated. Verbal behavior is defined by its function, not its form. What does that mean? Function, Y, form, looks. Okay. We'd rather that behavior or that the verbal behavior serve a purpose and not necessarily look a certain way. If that verbal behavior is appropriate and meeting the needs, that's how we're going to define that verbal behavior, not necessarily how it looks like. So verbal behavior does not only mean vocal behavior. Verbal behavior includes sign language. It includes augmented communication devices, written word, picture exchanges. This is a very important concept to know and remember. When we talk about verbal behavior, it does not necessarily just mean vocal. Vocal behavior is what I'm doing now, vocalizing. Verbal behavior is any sort of communication reinforced by another person's behavior. And then what function does the behavior serve? As usual, very important when we're talking about verbal behavior. So how do we mediate certain types of verbal behavior? Let's go over our big four: mands, tacts, echoics, and interverbals. Mands, we're going to reinforce request with the requested item. So keep doing that with the highlighter. Ask for apple, get apple. Very important, okay? To know how do you mediate the verbal behavior, what evokes verbal behavior, how do you reinforce it? A mand is evoked by an MO. Tacts. Tact is labeling in the presence of a nonverbal stimulus. Tacts evoked non-verbal SD, meaning you see something, you label it. Reinforced GCR. So if we're teaching tacting and our client sees a bus, they say bus, we praise them, we deliver a token, that's a tact. Tacts again evoked by nonverbal SDs. Mands evoked by MOs. You want something, you need something. Very important, again, you know how these different verbal operants are evoked and reinforced. Echoic. Echoics are evoked verbal SD, reinforce GCR. Echoics are repetitions of words, phrases, or sentences. I say, go get the Monopoly game. You say, go get the Monopoly game. Echoing. And then interverbals. Interverbals are conversational verbal behaviors under the control of verbal SDs. Evoked verbal SD. Reinforced with verbal reinforcement or GCRs. Okay, you also have your textuals. Reading, GCR, evoked, non-verbal SD, and then transcription, writing what you see. Okay, GCR. Textual transcriptions, echoics, mans, interverbals, we need to know what? We need to know formal similarity, point-to-point correspondence. All right. Formal similarity, does it look the same? Or does it appear the same, I should say? So if we are talking echoics, there's formal similarity because both are spoken. If we're talking transcriptions, the SD might be the spoken word, but you're writing it down. There's no formal similarity there. The writing and the spoken aren't formally similar. Now, they might be point-to-point correspondence because they look the same, right? They're point-to-point, they're the equivalent. Echoics are both formally similar and have point-to-point correspondence because they look the same and they are identical. You're matching exactly what I'm saying. Very important to know, does it have formal similarity? Does it have point-to-point correspondence? All right. Verbal operants can be a little overwhelming at first, trying to remember all these things. But once you just get down the idea, what evokes it, what reinforces it, formal similarity, point-to-point correspondence, it moves very quickly from there, and you're never going to forget them. All right. They're very straightforward, very simple. You also have autoclitics, the last one we'll talk about real quick. Okay, autoclitics, they modify these. So for example, instead of bus, you say the big bus. We're modifying our operands. All right. Use equivalence-based instruction. We're talking about reflexivity, symmetry, and transitivity, stimulus equivalence. Okay, so reflexivity is what? Reflexivity is A equals A. Symmetry is what? A equals B, B equals A. Okay, and then if we get all the way up to transitivity, which is what we're going for, is A equals B, which equals C. Okay, therefore C equals A. That's what we're talking about, equivalence-based instruction. Okay, I have a picture. Pic equals the picture. Okay. Pic, the word equals the picture. So a picture equals a picture. Then we have the word equals the picture, right? Down here, we're going to have the word, the picture equals the word equals the actual thing. Therefore, what? The picture, actual thing. That's what we're talking about, equivalence-based instruction. Okay, so you're first going to teach a picture of an apple. Goes with an identical picture of an apple. Then have them match picture of apple to a picture of a group of fruits. So we're now in a category. We know the apple is part of that fruit. All right. And then eventually, okay, would now, all while labeling these items words, the student would derive that the picture of an apple equals the spoken word fruit. Okay. A little confusing at first, but all we're doing is we're trying to get new behaviors to form. All right. Because what we're doing, we're labeling pictures as we match them to words and pictures of it and real life items. As we're labeling them, the learner starts to deduce that, okay, so A equals B and B equals C, therefore C must equal A. That's really equivalence-based instruction. Okay, stimulus equivalence. All right, G13, use the high probability instructional sequence. This is what? This is your, all right, high P, low P. Okay, you should know this from your RBT days. Presenting the learner with multiple easy requests before presenting difficult requests. You want 2 plus 2, you say clap your hands, touch your nose. What's 2 plus 2? Important, the behaviors in the high P sequence should be in the learner's repertoire. So the high probability requests you're making, you shouldn't be teaching them. They should already be easily evoked, because remember, you're trying to build up behavior momentum. Okay, sip of water. All right, differential reinforcement procedures, okay, or reinforcement procedures to weaken behavior. All right, we're talking about reinforcing one behavior and putting other behaviors on extinction. So let's start with our easy ones: DRI, DRA, DRO. DRI and DRA, what are they doing? We are teaching what? Replacement behaviors. Okay. Both of these, replacement BX. What's the difference? The main difference is what? In DRI, differential reinforcement of incompatible behaviors, the behavior can't occur at the same time as old BX. Alternative behaviors, replacement behavior, can occur at the same time. That is the main difference between DRI and DRA. If you want to teach a behavior with the same function that looks differently and can't happen at the same time, you're going to use a DRI. If you don't care about the replacement behavior, what it looks like when it happens, you just need a replacement behavior, you might use DRA. So you're going to reinforce new BX, extinction, old BX. What about DRO? DRO, okay, no replacement behavior, doesn't teach a replacement behavior. Reinforce absence of target BX. It's a little difficult to kind of wrap your head around, right? Reinforcement happens when behavior is not happening. We're looking at hair pulling. If Julie doesn't pull hair, we reinforce her. It doesn't matter what else happens during that time, because we're not teaching a replacement behavior. As long as Julie doesn't pull hair, what happens? We reinforce her. All right. Those are the 3 basic differential reinforcements. Another way to use reinforcement to weaken behavior is functional communication training. So if we're trying to reinforce functional communication over maladaptive behavior, we would teach our client to ask for a break instead of eloping. We do this all the time. Okay. Reinforce the communication, put the eloping on extinction. DRL, lower rates of behavior. Reinforce if the behavior happens less than a specified amount. So if Timmy gets up less than 3 times during class, he gets a 10-minute break on the computer. So with DRL, you might have started at Timmy gets up less than 5 times. You slowly reduce it 4, 3, 2. All right. So it's not like you're trying to eliminate it entirely. You just want those rates to go down, decrease. Okay, not eliminate entirely. DRH, right, is the opposite. DRH is differential reinforcement of higher rates of behavior. Reinforce if the behavior happens more than a specified amount. Okay, so in this example, your client answers more than 10 math problems. Within 5 minutes, they earn a cookie. So we might have gone from 8 to 9 to 10. Okay, you're reinforcing that behavior. It's happening more than the specified amount after a set interval. DRL is similar to DRD, diminishing rates of behavior. All right. We're both trying, in both instances, we're trying to reduce a behavior, but DRL is typically going to deal with a number of responses. DRD is going to typically deal with a time limit or time frame. All right, G15, extinction. Extinction is our 3rd principle. We should all know what extinction is. Discontinuing reinforcement of a previously reinforced behavior. I didn't go too much into the outcomes of extinction, right? We should kind of know it by now. What are we looking at? We're looking at extinction burst. Okay. Spontaneous recovery. Okay. Resistance to extinction. When we are fighting through extinction and the behavior is getting worse and worse. Aggression. Aggression induced. Okay. So the extinction causes aggression. Right. So if we were to map out how this would look, how extinction would look, we would get here. Our behavior would be here. Let's say extinction starts here. What's going to happen? Extinct behavior is going to start to increase. We're going to hit this point, our extinction burst, that temporary increase in behavior. Behavior should start to decrease, right? Okay. And then extinction over. What might happen? Suddenly, that behavior spikes. This is our spontaneous recovery. If we treat that as we have before, what's going to happen? It'll go back down to normal levels. Okay. Ensure all ethical considerations are taken when putting behaviors on extinction. Self-injurious behavior. Safety. Is it safe to put things on extinction? Make all parties aware of the potential effects of extinction, including extinction burst, as well as behavior contrast. If we are putting a behavior on extinction in one setting and we're not changing the behavior plans in other settings, okay, we might see that behavior increase. Be aware, right? Be aware, BX, contrast. Extinction, very straightforward, one of our most basic concepts, one of the first concepts you learn, all right? Extinction doesn't change just because you're taking a BCBA exam, the same idea. Use positive and negative punishment, just like reinforcement. Okay, what does punishment do? Punishment decreases behavior. Reinforcement increases, punishment decreases. Positive is adding, plus negative, removing, minus. All right. What kind of punishments are we talking about? Well, we have timeout. We have a temporary removal or restriction to a reinforcer. We have exclusionary timeouts where the child is removed from the environment altogether. They're excluded from the peers, the environment where it took place. Or we have non-exclusionary timeout. It might be a barrier timeout where the child stays in the environment, but the reinforcer is removed. Very important that you know the distinction. Okay, timeout is a punishment procedure, right? Now, yes, we do often say it's not always a punishment procedure, but we typically think of it as a punishment procedure. Okay, and in the literature, it's referred to as a punishment procedure. Doesn't mean it's going to be punishing. That's a very important thing to remember as we talk about this, right? Because all that matters is how it impacts the future behavior. However, for the basis of our task list, timeout is considered a punishment. Temporary removal or restriction to a reinforcer. So it doesn't always just mean removing the person. You might just have timeout from a video game or a candy, whatever it might be. Response cost. Response cost is removing reinforcement in the presence of maladaptive behavior, typically used with token economies, but can be used anywhere where your client or person is earning things. You can take those away in the presence of maladaptive behavior. This is a form of negative reinforcement. All right. Overcorrection, positive practice overcorrection, having the client practice the correct behavior repeatedly after engaging in the maladaptive behavior. Keyword here, correct behavior. Positive practice is correct. What is negative practice? Negative practice is maladaptive or incorrect behavior. That's the distinction. With positive practice, you're going to do the correct behavior over and over again. Throw away your trash, throw away your trash over and over. Negative practice, maladaptive behavior repeatedly. If they color on the walls, you might have them color on the walls over and over again. for example. And then restitutional overcorrection, have the client return the environment to a better condition than before the behavior was displayed. So if they wreck the kitchen, right, or if they wreck their room, you're not only going to make them clean their room, you're going to make them clean the whole house. G17, token economies. One of the most common interventions in ABA. We have our standard little token boards, okay? You've probably seen these, 5 tokens. What are tokens? Generalized condition reinforcers can be used in a variety of places. How did they get there? Well, they were paired with things, all right? Tokens are given value based on backup reinforcers, all right? Very important that you establish backup reinforcers when giving token economies, because how does a token economy typically work? All right, you set a value for the GCR. So GCR equals, let's say, 5 tokens. They earn 5 tokens, exchange for GCR. So you set a price with the tokens or the whatever you're using. Whenever the person earns however many tokens they need, they exchange those tokens for the GCR. So you can really build an economy. You might have 4 or 5 different reinforcers available. iPad is worth 10 tokens. Break time with peer is 5 tokens. Okay. Going work in the computer lab is 8 tokens. And they have to hit that number of tokens and exchange them in order to earn the reinforcer. That's what we mean when we say token economy. When we're developing token economies, we should always set the prices low initially. That way our clients are contacting reinforcement quickly. Once they get adjusted and we're seeing the behavior change we want, we always want to make sure we're adjusting our economy as necessary. If in the beginning, the GCR costs 5 tokens, but the client quickly gets there, maybe we increase that number to 9 tokens, okay? We can change that economy. Always, always, always also be running preference assessments. Make sure those backup reinforcers, okay, are still relevant at all times. Constantly be updating your backup reinforcers. That's the main piece of the token economy. Without good backup reinforcers, the tokens have no value. The token economy doesn't work. Response cost, we just talked about it, is a big part of token economies. Tokens, like we said, are generalized conditioned reinforcers. And then once tokens are obtained, they're exchanged for backup reinforcers. All right, group contingencies. We have 3 different types we will talk about. Group contingencies involve one person in a group, the whole group, or each individual in the group. Keyword, group. What are our 3? We have dependent. The group contingency is met when one person or a select few people engage in the target behavior. Meaning, if one person, or let's say 3 out of 10 people, meet the requirement, the whole group gets reinforced. Now, you might immediately say, well, that could be an issue. Absolutely, it could. Often called the hero contingency. Jim is in a class of 20, and it's all on Jim to meet the contingency. What happens if Jim doesn't meet the contingency? Nobody gets reinforcement. What can happen? Can lead to bullying and other negative social implications. This is why you must be smart when choosing your group contingencies. Okay, so for example, if we have 6 kids in the class, it's all dependent on the black dot for reinforcement, the hero. Independent, the group contingency rewards each individual in the group when they engage in the target behavior. They do not rely on other members of the group. So each person is responsible for their own well-being. So in that case, the group might look like this. Okay, everybody is their own person. And each person dictates their future. The person doesn't care about the reinforcer. There might not be motivation, because it doesn't matter if 5 of our students here complete the task. The person who doesn't won't get reinforced. Each individual in the group. And then interdependent awards the entire group when the entire group engages in the response. So in this case, we need all 6 to get reinforcement. We're talking whole individual group. Problem here, individuals who meet the criteria may not get rewarded. If you've ever done a group project in school, you understand that feeling, right? You do all the work and your other group members still benefit. And that's an interdependent group contingency. Contingency contracting, often referred to as a behavior contract. What do we need? All right, we need description of the task. So let's make our contract. What needs to be done? Spell name. This is obviously very basic. Spell name. That's our task. Reward. Okay, reward. Xbox. Wow, that's a pretty good reward, right? Task record. Okay. Routine assessment of task. Ongoing assessment of task. Okay, what is your criteria? What is your mastery? So we need some sort of mastery, right? Or criteria, which is our record. How are we going to measure it? Okay, so it needs to happen, once per day. What's the consequence of not completing task? Consequence, no, Xbox. All right, and then signatures. Signature, and then, all right. So very straightforward, but contingency contracts, behavior contracts, you should treat them like legal documents. Meaning, once you sign this contract, and we have a date, right? We have 6 months. Once you sign this contract, do not change the contract. It's no longer a contract. When you keep making adjustments to the contract you signed, you're not actually using the contract. Okay, everybody needs to abide by what's in the contract. If you're going to change it, start a new contract altogether. Very important. And this is why contracts are usually used for older individuals, higher functioning individuals, okay? Because it is a very self-monitoring thing. The whole idea is we're trying to fade all the ongoing reinforcement and trying to get some long-term reinforcement at play, right? We have to work towards these things, okay? Additionally, if our task is spell name, that's our target, right? Now we might put spell name correctly, but you don't want to start throwing in a bunch of other requirements. You don't want to put spell name and wash dishes, okay? If this is what our contract says, we can't just add things on, especially if, let's say, our client is nailing this contract, right? They are easily spelling their name once per day. Don't now change the requirements to spell name and wash dishes. Not fair. It's not what you agreed to. And that's why we sign it. The contract should not change. Self-management strategy, also known as self-control. Why is self-control a misnomer? Because everything we do is actually controlled by the environment. Okay, so we can use self-management strategies to help change our behavior, improve our behavior, modify our behavior. But in the end, it's still all affected by the environment. So self-management is a personal application of a behavior change that produces a change in behavior. Okay, really a desired change in behavior. We can increase or decrease behavior. Okay, but it's a desired change in behavior. What do? We self-monitor, we self-evaluate, and we self-instruct. So self-monitoring, you're observing and responding to your own behavior, either through checklists, right? Through surveys, through video records. So you're observing yourself and responding to that behavior as you're trying to change it. If you have an exercise chart, all right, and each morning you're supposed to run 30 minutes. On your exercise chart, this is how you're going to monitor yourself. You ran 30 minutes Monday, 30 minutes Tuesday. On Wednesday, you only ran 25 minutes. Your exercise chart, your self-monitoring should reflect that, right? And then you're going to evaluate your own performance relative to a standard. So you are trying to reach 30 minutes a day for 7 days straight. You look at your monitoring chart, you only hit 5 days. Now it's on you to evaluate yourself. How can you stay motivated? Well, through self-talk, individual prompts. So you might, when you wake up in the morning, You might have your running shoes by your bed and your AirPods ready to go. So there's minimal effort required to get outside and run. You might pump yourself up through self-talk, thinking in your head or talking to yourself, hey, as soon as I get up right now, I'm going to get out of bed, put my shoes on, and just go outside and start running. That's self-talk. Okay, this is all self-management. What we really want to accomplish with many of our clients is getting to this point where they're not relying on us or other people for all this contrived reinforcement. They're able to manage themselves. Other ways, mass practice, okay? So if you continue to screw up, maybe you perform the undesired behavior repeatedly in an effort to reduce the behavior. Again, kind of a little bit like negative practice, right? Habit reversal, you're trying to reverse and break some of your habits. And then desensitization, okay, desensitizing yourself to stimuli in the environment. G21, use procedures to promote stimulus and response generalization. Generalization is essential to good ABA practice. If we're not generalizing, okay, we're not doing our job as analysts. I don't care, and you shouldn't care either, if your client can do the skill in the training environment. How is that going to help them in the natural environment? Generalization is a key. It's one of our dimensions. Generalization is performing a skill in an untrained environment. How do we get there? How do we promote stimulus and response generalization? Well, let's quick refresher. STEM gen is what? That is one response across multiple stimuli, right? Response gen is what? That is multiple responses, one stimuli. Okay, easy as that. Stimulus generalization, response generalization, very straightforward. Remember that, you'll never miss it. So how do we get there? First, train loosely. Non-critical aspects of the environment are varied, meaning non-critical. So if you're teaching someone to shop at a store, you're not going to just change the cash register to a basket of fruit. That's a critical aspect of the environment. But you might change the training environment to have different products, different lighting, different music, different people. These are non-critical aspects of the environment that are going to impact your generalization. Okay, it's unstructured, ever-changing. Indiscriminable contingencies. The learner doesn't know when the reinforcement will come. This is why we're always trying to fade reinforcement. While we use variable reinforcement, the learner should not be able to predict reinforcement is coming. Multiple exemplars. Practice with many different stimuli and response variations. For example, client says their phone number to many different people, but they can also write it and text it. Okay, so we don't want to just train one way to do the skill with only us. What happens when they have to do that skill differently in a different environment? That's why you want to use multiple exemplars. Program common stimuli. So just like we want to use, just like we want to train loosely, change the environment, make it unstructured, we also want to program common stimuli into the environment. We want to make the environment as close to the real thing as possible. Okay, so these kind of go hand in hand because you want to make the environment as close to the real thing as possible. So your home, if you're teaching home, you might want to make it as close to a classroom as possible. Okay, but even then, that environment is still going to change. So you still constantly change the environment. You don't want to just have a replica and never change it, right? You want that to be ever evolving, not so structured to where one minor adjustment freaks them out, right? Or affects their ability to perform. Natural contingencies, contingencies that occur in the natural environment. So not contrived. So natural consequences. If I give the wrong change at a store, they might give me the proper change back. They might keep the proper change. They might ask me for the right change. That's a natural consequence. And then general case. You want to teach all stimuli and the response as you can. So you want to teach as broadly and cover as much of your bases as you can. You definitely want to know this section, okay? They will ask you questions about this. And then using procedures to promote maintenance. So what is maintenance? Maintenance is the ability to engage in the target response. Here's the key. after teaching is withdrawn. Don't confuse generalization and maintenance, right? In a way, maintenance is part of generalization, because if we're maintaining the behavior, that behavior is occurring anywhere we need it to occur, all right? But maintenance is after the teaching is withdrawn, okay? So I teach 2 + 2, 2 + 2 for 4 months. Stop teaching for a month. And then this month 6, I ask 2 + 2. If they can still answer 2 + 2 in month 6 after a month of no teaching, they've maintained. Easy as that. How do we get there? We fade prompts, we fade instructions, all right? We make it more natural, then reinforcement schedules, okay? Because remember, when we get to the natural environment, reinforcement is not going to happen as rapidly as it does in our trained environment. All right, on to H. I'd like to get a sip of water. State intervention goals in observable and measurable terms. So now we're kind of jumping back to assessment and treatment plan writing. Why is it important that we have observable and measurable terms? Well, in ABA, we are operant based. So it's critical that we use the environment and things we can see and measure to our advantage. Whenever we're teaching goals, we need to be observable. They need to be observable and measurable so we can understand, is our intervention working? What do we want to teach? What do we want to reduce? What do we want to accomplish? Goals should be what? Goals should be objective, based on data and set criteria. Avoid being what? Avoid being subjective. Not I think, I thought, it's I saw, I know. This is what happened. We want objectivity. Goals should be observable, public events, behaviors, and skills that we can see. We acknowledge private events as behavior. We can't see them. That's an issue. We can't program to change someone's frustration. You can't observe it. You can't measure it. We need to have public observable events. Measurable, again, behaviors and skills we can measure. Observable and measurable, very important. And then clear, remember our dimension, technological, easily read, understood, and reproduced by others. Good goals, right? Non-examples. State examples of what you're not measuring. You want to include, if it's a complex goal, what are we not measuring? For example, task avoidance does not include looking up from work for less than 10 seconds. This is not what we're looking at, all right? So why would we use that example? Well, if we have a client who does their work but tends to daydream a little bit, and we don't want to punish them for that, we might let them look up for 10, 15, 20 seconds. The only way your RBT will know that is if you provide non-examples. And then you want to plan for short-term and long-term. So our goal might also include what? We might have the learner, the goal, mastery, criteria, measurement, system, maybe a setting, and then length of time, right? We just want that goal as clear and complete as possible. Objective, clear, complete, observable, measurable. You do all those things, you'll write some great goals. H2, identify potential interventions based on assessment results and the best available scientific evidence. Very important. Empirical data, right? Empirical, what we observe, right? Our experiments, our data, okay? Analytic, okay? Using data to drive our decisions. Ongoing research, right? We constantly want to be observing, constantly educating ourselves. You want to use all available information to design our intervention and treatment plans. So always take into consideration, what does the client want and what the client doesn't want? Clients are part of our treatment planning. They have a right to have a say. Now we need to be logical about this, okay? If they're 5 years old, that's going to look different than an 18-year-old. However, they still have a right to say what they want and what they don't want. Parents as well should also be part of the treatment planning. Assessment results. What did the FBA say? What did our data say? We need to identify interventions based on data and evidence. Just because the data might not say what you want it to say doesn't mean we don't use it. Other factors, what about preference assessments, medical assessments, prior intervention history? All of those things we were doing in the beginning where we were looking at prior history, prior medical records, doing FBAs, doing assessments, all leading up to us writing interventions based on those results. This is why assessment is so important. It gives us the evidence we need to write good interventions. H3, recommend intervention goals and strategies based on such factors as client preferences, supporting environment, risk constraints, and social validity. Consider the client and client's environment. What is possible? What isn't? What do they prefer? All right. So H2 and H3, very similar. We're getting into the part of the task list that most people hate. Okay. They don't like this part of the task list. It's less terminology, less applied, and more conceptual, more theoretical. Now we're actually thinking about how we're going to design our interventions. With this, when you answer your questions, you need to really start thinking like a behavior analyst. You need to consider all of these things. What does my supporting environment look like? Where does the treatment take place? Is the environment capable? What about caregivers? Are they going to follow through? Again, what is the client like? What don't they like? Are they involved? They should always be involved, but to what extent? Are we maintaining client dignity? What about risk constraints? Anybody in harm's way? Okay, will we cause harm to anybody? And then obviously social validity. Are behaviors and skills important to the client, the family, and society? Really starting to think like behavior analysts now. All right, getting into these conceptual, more theoretical ideas. Okay, this part of the task list gives people issues. All right. So when you're taking your practice exam, okay, when you're taking my practice exam, start thinking in these terms. What are the client like? What is the environment like? What does the evidence say? What are the risks? Is it socially valid? H4, select acceptable alternative behaviors when target behaviors are decreased. I'm personally really glad the 5th edition gave this H4, gave alternative behaviors its own section this time. Because I think this is such an important piece that so many people miss. What is this saying? Select acceptable alternative behaviors when behaviors are decreased. We're talking about decreasing behaviors as analysts, right? So what do we know? All behaviors serve a function. If you get rid of a behavior, if we decrease a behavior, what have we done? We've removed a functional action from the learner's repertoire. Okay. So if in the past we obtained attention via aggression, this is our function. The function of aggression is attention. Now, obviously, we want to decrease aggression. But what happens when we decrease aggression? Well, how will our client gain attention? That is what we're talking about here. We got rid of their ability to obtain attention to aggression. We need to teach them another way. This is our fair pair rule. Whenever a behavior is decreased, another behavior must increase in its place. We need a functional equivalent behavior. So instead of aggression, we might increase what? Functional communication training. Both serve the same function. We've still given our client the ability to obtain attention just in a more appropriate way. H4, I think, is super important. I'm really glad they gave it its own section. All right. Remember, fair pair, functional equivalence. H5, plan for possible unwanted effects when using reinforcement, extinction, and punishment. Ethical conundrums here, right? What might happen when we use these different ways or these different principles, right? Our big three: reinforcement, extinction, and punishment. Always consider the possible consequences of the interventions you design. Like I said, we're now getting into the theoreticals, the conceptuals, the what ifs. Reinforcement's great, right? It's what we use. It's what we use to change behavior. But what could possibly happen with reinforcement? Well, we might satiate on a reinforcer. So we get too much of that reinforcer. We lose the value of that reinforcer. What should we do to avoid that? Well, we need to make sure to pair other items with that reinforcer to create multiple reinforcers. We can't just rely on one, because if we satiate, we're in trouble. What about a decrease in other functionally equivalent behaviors that aren't receiving reinforcement? If I'm only, increasing, asking for break for escape, what might not go, what might decrease? Actually completing work. This happens all the time. Where we teach a client to ask for a break, that behavior skyrockets because now they escape. What do they stop doing? They stop completing their work. Okay, so you have to be careful what you reinforce. And if you're going to reinforce, make sure we're reinforcing multiple types of behavior. Okay. Now, not always, but especially in this instance. Reinforcing an undesirable behavior on accident. We've all done it, especially with attention. We see a behavior occur. Okay, we aren't thinking or we make a mistake and we reinforce that undesirable behavior on accident. We just need to adjust. And then difficulty transitioning away from a reinforcer. iPads come to mind. You spend 10 minutes on the iPad. It's time for transition. They don't want to. We get maladaptive behavior. So again, ways to avoid fade reinforcement quickly, reinforce all functionally equivalent behaviors, self-management, incidental teaching, and variety of reinforcers. What about extinction? Extinction, the intensity of extinction bursts could be high. Now, extinction is the one we really want to pay attention to, and punishment, but extinction is the one we typically think of, right? Because with extinction, we're thinking of extinction bursts. We're thinking of unethical extinctions, the danger of extinctions. Can caregivers manage? Okay, can caregivers manage the extinction burst? Okay, extinction can be very difficult, can be very tricky. If that behavior is really increasing in intensity, that follow through could be tough. But we have to be aware that if we stop extinction in the middle of a procedure, we've now reset the reinforcement schedule. We might have made it worse. Okay, how do we avoid it? Plan, 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 plan. Always be planning. You know extinction bursts are coming. You know spontaneous recovery is coming. Plan for it. Easy as that. Ensure fidelity is there. If we're going to do extinction, how often does extinction need to occur? 100% of the time, or as close as possible. We're not perfect, obviously, but extinction half the time doesn't cut it. We need good fidelity. Okay. And then punishment. We can have punishment-induced aggression, resistance to punishment, ethical and legal violations, harm to client or others. Again, how do we avoid it? Plan, 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 and train. Okay. I think this is a good section to review over and over again. It's going to give you some good guidance on some of the more wordy or conceptual questions I ask. H6, monitor progress and treatment integrity. As I take a sip of water. IOA, everybody's favorite. Not really. Everybody's so scared of IOA. All right. You don't need to be. Okay. They might not even ask you IOA questions, but if they do, understand, I'm going to go over 4 basic ones. Okay. 4 IOAs that if you know, okay, you're going to be able to answer them on the test. So what is IOA? IOA is inter-observer agreement. We're looking for treatment integrity or fidelity. Okay. Is our treatment being implemented correctly? With IOA, we can empirically measure that. We're going to take 2 or more people to take data on the treatment and then compare the observed values. So I watch you. Okay. So let's just say, observer A, B, and C all watch the same thing. They take data and they get a number. That's IOA. IOA should be collected for 25 to 33% of sessions, give or take. Okay. You're really looking for like 90% or above in IOA. Okay. You want that IOA to be high as possible. So first, IOA, don't lose me here. All right, this looks like math. We didn't get into behavior analysis for math. I agree. I'm on board with you. Don't run away screaming. You're smart enough to understand that. That's why you are becoming a behavior analyst, because you are smart. You can do it. First one, total count IOA, the easiest one. We're going to take smaller count, divide it by the larger count, multiply that by 100. For example, our smaller count, observer 1 got 3, observer 2 got 5. We're going to take our smaller count, divided by our larger count, multiplied by 100. That's going to give us 60% IOA. Nothing to it, right? Very easy. Mean count per interval IOA. Okay, we're going to do the same thing. We're just breaking it up. Okay, calculate total IOA for each interval. So we have total count IOA. So for example, interval 1, okay, with total count. So we take our small number, put it over our big number, and we get 75%. We do that for interval 2, and then interval 3. So this is just total count. And then what? You just add them up. Okay. You just add them up and find the average. 75% IOA. Okay. That's all you're doing. IOA is going to just take a little practice, right? My recommendation is always do IOA last. Okay. I don't want you spending hours and hours and hours and hours on this. All right. If there's one thing, this is bad to say, but if there's one thing you don't know going into the exam, it's how to calculate exact count per interval IOA. You need to know IOA, what it is, why you do it. But if there's one thing you forget or don't know how to do, it's this. Now, going into the exam, please know everything. Okay, don't say I told you to not know this. I'm just saying, do this last. Don't spend a ton of time on it. All right. Exact count per interval IOA, the most strict. Okay, most strict. Percentage of intervals in which observers recorded the same count. So we're looking at our intervals 1, 2, and 3. What percentage do we have the same count? Interval 1, 1 and 2, nope. 3 and 3, yes. 2 and 3, no. So what do we get? 1 divided by 3, 33% IOA. Again, very straightforward, not difficult math, not too difficult. All right. It only looks difficult because it's brand new. Once you kind of get it down, no big deal. And then the last one we'll cover is trial by trial IOA. I think technically there's 6 or 7 ways to do it. Not forget the exact number. All right. However, know these 4 and you'll be able to find whatever you're looking for. All right. Trial by trial, the number of intervals of trials in which the observers recorded the same occurrence or non-recurrence. Okay, either recorded a response or did not record a response. Okay, so we're not looking at here, we're looking at the exact number they got, right? Trial by trial, we're just looking at did a response occur or not. Okay, so here, right, either record a response or did not record, right? The total data does not matter, only whether or not there was a response. Trial by trial, IOA. We put trials in agreement divided by total trials. That's where people get confused, okay? We're not looking for the intervals that have no responses or the intervals that have responses. We're simply looking for the intervals in agreement. For example, interval 1, they agree, no response. Interval 2, they don't agree, but interval 3, they agree on responses. Therefore, we're going to take our 2 trials in agreement, divided by 3 total trials times 100 and get 67%. Okay. Don't panic. Don't freak out. All right. Do these last if you're really worried about it. Okay. I want you to get everything else cold, memorized, just automatic. All right. And then come to IOA. H7, make data-based decisions about the effectiveness of the intervention and the need for treatment revision. It sounds familiar because they're trying to hammer this home. Everything is data-based, okay? And this is where we're going to determine, do we continue, okay, the intervention unchanged? Do we continue with the intervention but change it, or do we discontinue the intervention altogether? How do we determine that? Well, there's one simple word: data. Everything is data-driven, okay? Are we being effective? Yes or no? Effective means producing the desired or intended result. Just because something changes does not necessarily mean it was the intended result and that it was effective. Things change all the time, but maybe not how we intended. When you look at the data, you have three options: continue with it, unchanged. You're seeing progress. Treatment is effective. You want to give it more time without changing it. Totally acceptable. What about continuing with the intervention, but you're going to change it? Okay. May or may not be progress. You like the treatment, but you want to modify it in some way. Or you hate the treatment altogether. It's not effective. Does data indicate treatment's ineffective? You want to change it altogether. You stop the treatment and design another. Okay. Remember, treatment should be organic. Do not get married to a treatment. If it is ineffective, change it ASAP. H8, make data-based decisions about the need for ongoing services. So if we're going to look at ongoing interventions as kind of our micro look at things, our day-to-day, ongoing services is macro. Do we need services anymore? What are we trying to do? We're trying to work ourselves out of a job. We don't want our clients to have our services. We want them to be able to be successful without us. The entire goal. But we don't abandon clients. First and foremost, do not abandon clients. If the decision to leave the client is made, there should be a transition plan in place. We should give them plenty of notice and plenty of time. The decision needs to be data-driven. Everything is data-driven. Don't just make assumptions on need, all right? Because again, what are their needs, right? Several things go into a needs-based assessment. Never search for behaviors that need modification, meaning if you've hit all your targets, hit all your goals, once goals are met and no other goals are identified, don't just start making things up because you want to keep the client, all right? Transition them out, bring in a new client. Other things to consider. Are services benefiting the client still? Are they still beneficial? Sometimes we've made no progress, but they're just not benefiting the client or stakeholders. That's fine. It's no big deal. Okay, we can't win them all. Are we targeting socially significant behaviors? Do the behaviors even matter, right? Are we just there as babysitters? Have we failed to achieve our goals, or have we failed to make progress? If we're 8 months in and we haven't achieved anything, it might be time to have a hard conversation, okay? And then are stakeholders failing to uphold the responsibility of services? We have the right, okay, we don't abandon clients, but we have the right to terminate contracts with clients. We don't abandon, we have the right to terminate, okay? As do our clients. They have the right to reject services at any time. Data-driven, again, does the data indicate the interventions are still needed to increase or decrease target behaviors? Everything we do is based on data, all right? Ongoing services are tricky when you get into it. It's a lot more gray than the test makes it out to be. But on the test, you want it to be black and white, okay? Based on our task list information here, that's how we should be answering our questions. H9, collaborate with others who support and provide services to clients. At the very beginning of our video, we talked about reviewing education documents, IEPs, 504s, NDTs. Once you take on a client in school, their education team becomes part of your team. You should collaborate with them to provide the best services possible. Now, we hate collaborating. I get it, right? We are always right. Okay, I'm being sarcastic here. Okay, but a lot of people do hate collaboration. However, I can tell you, collaboration with parents, collaboration with therapists, with educators, always lead to better outcomes. Okay, always be collaborating. So what's a multidisciplinary team? It's our group of individuals who provide each specific service to clients. Okay, you get ABA, you get speech, you get OT, you get school. That's all part of our team. How do we collaborate? We share information. Always, always, always obtain confidentiality agreements. So on the exam, they ask you, a speech therapist reaches out to you and asks for information about your client. What should you do? Always check that they have a confidentiality agreement, and always check that they have permission to receive the items. Okay. Only share data and progress information with the team, but you should share data in progress. We want to be on the same page as other practitioners. Obtain information. Similarly, you should go out of your way to seek out helpful information from others when necessary. Attend meetings if allowed. Go to IAP meetings, other services. Parent training are a vital part of the team. Parent training is huge because when we're not there, we need to be sure our interventions are being ran. And then always accept feedback and input. Just because we give all the feedback to our RBTs doesn't mean we're exempt from feedback. Okay, we don't know everything. If somebody, this is pretty common question, if somebody is on the multidisciplinary team, let's say the speech therapist, recommends a diet, okay, and the parents want to go through with it, how should you respond? We don't immediately say, well, our data, or all the research says this, that is improper, we shouldn't do that. Remember, we're part of a team. Offer, okay, to try out the diet, but take data on it, and then let your data tell the story. Okay, always let the data tell the story. I1, state the reasons for using behavior-analytic supervision, behavior-analytic supervision, and the potential risk of ineffective supervision. Now we're talking about supervision for our RBTs. Okay, why do we do it? First and foremost, well, we're ensuring treatment is proper. That's why we do it first and foremost. That should be the goal. It shouldn't be to go in and save the world. It shouldn't be to go in and humiliate your RBT or show how smart you are. We want to make sure our treatment is being provided properly and that we have the right things in place. Okay. We are also responsible for training. Okay. And this provides the best chance of optimal outcomes. Some terms to know for supervision: treatment drift, when the intervention differs from the original design. So the reinforcement schedule was FR2. So day 1, FR2. You haven't changed anything. Nothing's changed. Day 30, VR3. Treatment's drifted. Okay, we need to supervise, get them back on track to an FR2 and what's exactly supposed to be ran. Observer drift. The way the outcomes are measured start to change. Okay. You might want to measure protest behavior, but instead we're measuring self-stimulatory behavior. Okay. If you see data that looks like this, 3 the first day, 4 the second day, 3 the third day, and then all of a sudden we get, 15, we need to go in and check what happened. Maybe it was just a spike, or maybe we targeted or observed the wrong thing. Okay. Reactivity. Treatment or measurement changes when the person being observed is aware they're being observed. This can go for the client, the RBT, parent, even us. Everybody typically reacts differently when they're being watched. So we have to think about reactivity. Okay. And then procedural integrity. Specify what we want, train on it, monitor, reinforce proper behavior. Supervision should be done with behavior analytic terms in mind, meaning you provide reinforcement, you put things in extinction, you determine functions. Okay. Poor supervision leads to poor outcomes and poor performance. I2, establish clear performance expectations for the supervisor and the supervisee at the outset, onset of the relationship. When the relationship starts, we need clear expectations, clear goals, or the outset, I should say. The outset, right? As clear as day, what do you expect of your supervisees? I hear all the time, RBTs, I don't know what my BCBA wants from me. That's a tough relationship. They should know exactly what you expect each and every time they go to treatment. You should also have goals on how you'll provide supervision, and you should accept feedback from RBTs. Okay, big part of it. Everything should be data driven. If you're going to give feedback, do it based on data and observation. All right. If goals and expectations are not set, supervision is not appropriate. I3 is going to be further down. I4, train personnel to competently perform assessment and intervention procedures. It is your job as the behavior analyst to train, okay? Competency-based training ensures service providers are capable of delivering proper service. RBTs are essential in the service delivery system. Never forget this, okay? It can be easy sometimes to get frustrated, to get annoyed, to get aggravated. Always remember how important our RBTs are for outcomes, okay? This is why we need to train them to the best of our ability. How do we do that? Well, one, what skill are you training? Are you training shaping? Maybe so. So shaping, okay, just for example, shaping. 2, write a plan, okay? What is your plan? What do you hope to accomplish? Mastery, okay? Mastery of shaping. 3, model the skill. Always be modeling, right? Always show them how it's done. Show them. 4, role play, okay? Act it out before you actually do it. Let them do it themselves. 5, observe real life. How'd they do in real life with the client? 6, provide feedback. Yes, good, no, bad, reinforce, blah, blah, blah. Okay. Personal or competency-based training. Describe, model, role play, observe, feedback. I5, use performance monitoring, feedback, and reinforcement systems. If you notice, all of these things are very similar to when we teach skills to our clients. Okay, we're still using behavior analytic terms, behavior analytic methods. All right, we're just doing it with our RBTs. So performance monitoring can be indirect or direct. Doesn't change. Direct is observation or implementation in the field during role play, okay, or during role play. So observation, as usual. We can look for what? Knowledge of treatment plan, treatment integrity, understanding of concepts, interacts with stakeholders, okay? Always beware of reactivity. RBTs are going to act differently when you're around. Be sure you know that. Indirect, supervisees report their own experiences or fill out rating scales for themselves. So progress monitoring through the act of them filling out self-evaluations, okay? Self-monitoring systems. Just like in our other assessments, indirect assessments are never enough. We should always be directly observing. Performance monitoring should happen routinely, at least once a month, if not more. And then performance monitoring uses the same data collection that we use with clients: continuous, discontinuous, permanent product. How should we deliver feedback? Feedback should be direct. Feedback should be constructive. Feedback should be based on the implementation of services and not on the relationship you have with that RBT, okay? Who's number one? Client, always about the client, okay? What was done incorrectly? What can be improved upon? How do we improve? Accept questions, keep it positive. And then always, right, reinforce when good things happen, okay? Sometimes we forget to do that, okay? We kind of settle in, things are going well. We forget to appreciate and reinforce good behavior. So reinforce correct supervised behavior praise, GCRs, or unconditioned reinforcers. I6 and I3, use a functional assessment approach and select supervision goals based on assessment of the supervisee's skills. Okay, so just like our other skill-based goals, we're doing everything based on our assessments. Establish goals the same way we would set goals for client. Does your client need to work on behavior modification, data collection, parent rapport, etc.? What are we trying to focus on with our technicians? Okay, what do our technicians need to work on? Okay, RBTs. What do they need to work on? Don't just train everybody on the same thing, because some people are better at things than others. Some people are really good at rapport. They just aren't good at data collection. Sometimes it's vice versa. Identify that, be a good behavior analyst, use good assessment, identify and go from there. Indirect, interview your supervisor. Direct, observe your supervising, and then create. Okay, remember, supervision is always behavior analytic. Always take the necessary steps to ensure proper supervision and to ensure proper service delivery. I7, use function-based strategies to improve personnel performance. Continuing on the same thing. By now, you should notice supervision is very similar to client work. Okay, now we're talking about function-based strategies. The behaviors our RBTs engage in also have a function. Okay, ABA is not just for clients, right? Performance should be observable and measurable. We're not too worried about emotions and feelings. Now, you don't want to be cold and callous, but we're not worried about that, right? We can't measure that. We can't observe that. Okay, we need to be able to change things we can see. How can we prevent these things, right? Antecedent interventions. What can you do to prevent poor treatment from occurring in the first place? Well, you can train, right? You can train better. Train better, okay. Clearer explanations. Okay, clearer definitions. You can put things in place, right? So these things don't happen in the first place. This is a reactive strategy, okay? Implementation. Why is poor treatment occurring? It's actually going on. So if we think of ABC, this is A, this is B, this is C, and BX consequence, okay? So why is the poor treatment occurring? Is the supervisee attempting to escape from behavior, gain attention from your client, gain access to something, or for self-stimulatory reasons? Functions don't change, right? And then how do you react? Always be mindful of how you react. Just because somebody did the most egregious, unacceptable thing you've ever seen, think before you react, okay? If implementation is good, reinforce. If it's poor, okay, go back to the drawing board. Design an intervention to correct the implementation. I8, evaluate the effects of supervision. Supervisors should be open to and request feedback from their supervisees. If you are not receiving supervisory feedback, you have no way of knowing how you're handling supervision. You should ask for feedback, especially as a new analyst. You're going to develop a lot of skills over the next year or two, and also a lot of bad habits. You're not going to know what you're doing wrong and right unless you ask. So always be open to feedback. Always, always, always. Okay. And then establish when supervision started, take data, compare data to evaluate the effects of your supervision. So were you a good teacher? Did you have no effect? You're not going to know unless you take data. All right, here are our references. Thanks for watching. Okay, be sure to check out BCBA study.com for all of our materials. Okay, ethics, video, ethics, part 3, coming soon. Okay. Other than that, any questions you have, please let me know. Any comments, leave them below. I'm happy to help. Work hard, study hard. You can pass your BCBA exam. Pass rate can be intimidating. The exam can be intimidating. Okay, but you can do it, right? You just have to put the time and the effort in. There's no other way around it except hard work.